Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Accessing and Using Public Health Data, Part 1. Today's webinar will be 1 hour in length. We will begin with an introduction by our moderator, followed by 2 presentations lasting approximately 15 minutes each, and ending with a question and answer period. This webinar is part of the 2017 ASPPH Presents monthly series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. We are pleased to have with us today our moderator, Christine Plepys, Director of Data Analytics at ASPPH. I'll turn it over to you, Christine.
Thank you, Sarah. ASPPH is pleased to present this 2-part webinar series on public health data sources. In Part 1 today, we are showcasing several available data sources and discussing data standardization among them. In Part 2 of this webinar series, we will focus specifically on data sources available from ASPPH. For today's webinar, we have 2 presenters. Our first presenter is Lisa Sedlar from the National Library of Medicine. Lisa is a librarian at the National Information Center for Health Services Research and Healthcare Technology. She has been in this role since 2003 and has primary responsibility for the Partners in Information Access for the Public Health Workforce website. Lisa received a Master's of Library and Information Science in 2000 from Kent State University and also holds a BS in Clinical Laboratory Science, also from Kent State University. Our second presenter is Dr. Elizabeth Harper from the Association of State and Territorial Health Officials, also known as ASTHO, where she is the Senior Director of Research and Evaluation. Elizabeth is responsible for ASTHO's work in research, journal publications, public health workforce, outreach and engagement, and evaluation. She completed her doctorate in Public Health Services Management at the University of Kentucky College of Public Health. While there, she served as a researcher for the National Coordinating Center of Public Health Services and Systems Research. We'll now turn the webinar over to Lisa for her presentation.
Thank you, Christine. Thank you. My name is Lisa Sedlar, and I am a librarian at the National Library of Medicine. And as Christine mentioned, I work at the National Information Center on Health Services Research and Healthcare Technology. And I appreciate the opportunity to speak with you today about public health data. For the purposes of this webinar, I'm going to distinguish between 2 types of public health data, health status data and public health workforce data. And we'll discuss some NLM resources to find data and the importance of standards. This is a very busy slide, but just to kind of quickly sum up the graphic, I just wanted to show the width and depth and breadth of all the different domains of public health information data. Unfortunately, we won't be able to go into all of them today, but wanted to represent the breadth of knowledge and depth of information for public health. So looking at public health status data, this is data that's generally used for community health assessments, community health improvement plans, program planning, interventions. And wanted to just quickly highlight a few sources. Obviously, there are many, many sources, and you could do a whole hour on health status, public health status data. One is healthdata.gov or data.gov. This contains over 190,000 data sets, and this is open and available for public use. And this contains a lot of information on public health related topics, such as those in transportation, agriculture, and nutrition. And also you can link over to healthdata.gov from here. Continuing on, obviously CDC has a wealth of health status statistics. They have a data and statistics page which provides a lot of links and tools and resources. And additionally, CDC also has the National Health Interview Survey data and the National Health and Nutrition Examination Survey, the NHANES data. One of the more locally focused data sets that CDC has is called Community Health Status Indicators, and this provides health profiles for all 3,143 counties in the United States. And their state, tribal, territorial, and local public health data stats that they have available from CDC is another good resource. And Robert Wood Johnson also has kind of taken on creating a culture of health, and part of some of their resources here you can see are the county health rankings and roadmap, and also Healthy People 2020, and each of those are very in-depth resources that could, again, be a webinar unto themselves. So all of those data sources, as well as many others, are also available from phpartners.org. There is a Health Data Tools and Statistics page there. And we'll talk a little bit more about PH Partners later, but I just wanted to highlight the health data tools and statistics that are available. And this is kind of hard to see. I apologize, it's small, but I wanted to kind of show a little bit about, we do have a lot in county and local health data, as well as individual state and metropolitan data, and there's really a wide range of data information available from that page. So now for the rest of this webinar, I'm going to focus on public health workforce data. So this is data about public health professionals and departments, looking at issues dealing with the workforce, with demographics, training needs, and education. Now, since public health is a very cross-cutting field, there's not one national registry or a licensing requirement, so enumerating the public health workforce can be kind of tricky. Membership organizations do provide a ready list of governmental public health workers, and academic and professional partnerships can also provide links to the public health workforce. So, for the rest of this webinar, we've defined public health workforce data. Now, where can we find data and surveys about the public health workforce? Well, I'm going to start with the National Library of Medicine. This is the NLM homepage. In the center column, you'll notice that there is a link that will take you to NLM's Health Services Research and Public Health homepage. Clicking on that link will take you over to this page, and you see that there are 3 resources highlighted by the green arrows I'm going to discuss. They include HSRR, HSRIC, and PH Partners. The first resource is HSRR, which is the Health Services and Sciences Research Resources. And this is our database of datasets, instruments, and indices and software. Currently, there are over 1,000 datasets and over 370 instruments. HSRR is not a repository of the actual resources, but it does include URLs of the provider for additional information and access, and has a very good description of the resource itself. Within HSRR, there's also a public health systems research subset of information, and that PHSR subset has over 230 datasets and over 65 instruments. So I just did a quick search of HSRR using the terms public health workforce, and you can see that you get 20 results, which isn't too bad. And you may also notice there's a PubMed search button to the left of all of the tools here. And what this is a canned search. So the search strategy is stable, and when you click that, it launches the search against PubMed. And the search for PubMed has been designed so that you can see when the data set or the survey was used or cited, so it can help you get an idea of how others may have used a data set or an instrument in their research. And this is just the results of clicking on the PubMed for the second result there, the survey of the public health nutrition workforce. The next resource I'm going to talk about is HSRIC, Health Services Research Information Central. This is our health services research portal site, and obviously health services research and public health have a lot of overlap. You can see the list of topics. I'm going to highlight the Public Health Services and Systems Research page. Here's the PHSSR page, and you can see the list of subtopics that are available on this page. If you're interested, you can sign up for either an RSS feed or an email service of delivery to be notified when new information is added to this page or any of the other pages in HSRIC. The arrow here highlights the search queries that we've developed for PHSSR. There's one for HSRProj and one for PubMed. The one for PubMed is a very broad search, and that is designed so that you can encompass a lot of PHSSR things within PubMed, but then it does require that you know how to go into PubMed, kind of tweak the search, add in additional terms to kind of narrow it down even more. So I wanted to talk about the search to HSRProj, which is our database of health services research in progress. So that link takes you to our HSRProj database. As I mentioned, this is a database of ongoing health services research. And this also contains records of projects that have ended, the funding has ended, but they still need to have the data crunched, the analysis done before going on, hopefully, to publication. This database contains federally funded as well as nonprofit and international projects. And the database also contains archived projects, those that have gone beyond the 5-year completion date, and that allows the health services research folks to see how research has changed over time. And this is also a good resource to find information about projects that may not have been published. Not every study that gets done goes on to publication. So this is a good way to kind of get a peek into what has been done that may not have made it to publication. And lastly, I just wanted to mention Academy Health is the health services research membership organization that we work very closely with here. And they've developed 2 different webinars specifically for health services research students. However, I think it would also have a lot of useful information for a lot of those on the call today. Both of them are called Back to School. One is Where Are the Data? And the other one is Enhance Your Research with HSR Methods, Tools, and Resources from the National Library of Medicine. You do not need to be a member of Academy Health to view the webinars. They're both free to view. Now I'd like to talk a little bit about phpartners.org. This is the portal site for the public health workforce. The mission of this site is to help the public health workforce find and use information effectively to improve and protect the public's health. All of the links that go onto this page are of high quality, and we are always searching for new information to add to these pages. You can see some of the specific public health topics, as well as some of the other more wide-ranging topics that cross-cut public health. The arrow here is pointing to public health workforce data. This is a page of public health workforce data that is available to use with a data use agreement. I didn't want to recreate all of the information that's already available through HSRR, so there is a link at the top here that will take a user back to HSRR if they can't find what they are looking for here. And there's also a link if someone came here thinking that they needed public health, other stats from the Health Data Tools and Statistics page, they can quickly get over there as well. We also have a page on workforce development, and this has a lot of information. Resources from the Health Resources and Services Administration, or HRSA, links to competencies, accreditation, continuing education and training, meetings, and workforce projects and research. And I just wanted to make a quick note. The phPartners site recently underwent a usability testing, and we have a new site that we hope to have live in a couple of months. I don't have an exact date yet. So if you come back in a couple of months or so, it may look very different. All the information will still be here, but it's going to have a very different look and feel to it. And another way to reach the public health workforce data is directly through state and local public health departments. A lot of them keep their own data available about their workers, the training that they've required. This may not be easily available and findable online. It may require a connection with the public health department. And there are a lot of connections between the academic world and the public health practice. Here are a few of them. And I also noticed that a lot of schools of public health have a partnership with the state or local public health department that is close to them. So why look for data before you survey? It's always good to know where to find public health workforce data. I wanted to just highlight this article from the American Journal of Public Health. This is a very recent article from November of 2016, and I just wanted to read the highlighted text here. There's a greater focus on evidence-based practices, practice-based systems research and evaluation has resulted in practitioners consistently receiving requests to participate in myriad surveys. This can result in a substantial survey burden for practitioners and declining response rates for researchers. This is potentially damaging to practitioners and researchers, as well as the field of public health more broadly. So everyone wants to survey for their own study, but public health doesn't want to be surveyed any more than it needs to be. So as has been presented, there's a lot of data that you can access at all levels of processing that would support interesting and original analysis and contribute to our understanding of how infrastructure relates to outcomes and other public health topics. And I started with the abstract, the first paragraph, and I'd like to go on now to the final paragraph. I would recommend that you take a look at the article. It is freely available. It has open access on it, so anyone can get to it and read it. It has a lot of good tips and tricks in there and things to think about before you would begin a survey. And they kind of wrap everything up with, we have also proposed greater coordination and comparability in survey efforts. Both researchers and practitioners would benefit from national repositories of validated survey items, accessible data from surveys of practitioners, and efforts from funders and grantees to share their data. I don't know that we're any close to getting a national set of survey items, validated survey items, but I can say that I've seen, and I think all of you have probably seen as well, that a lot of people are beginning to share their data more. And there we go. So since we don't have this national set of validated survey items, you want to be sure to use data standards whenever you can. Harmonizing data is always a good thing. That way you can always have those apples-to-apples comparisons. Here are a few links to some sources that you can use for standardized terminology. And also, since public health does run a broad range, cover a broad range of subjects, you may need to look outside of public health. You may need to look into education, into clinical medicine, or to other federal organizations like the Bureau of Labor Statistics to find information that you can use for a standardized definition. ASTHO, NACCHO, and NALBO years ago harmonized all of their survey data so that they're asking the same questions the same way. And ASTHO had a nice, easily findable link that shows how the harmonization works between the two surveys. The National Center for Health Statistics has data linkage activities. You can see more about that here. There are lots of data dictionaries and taxonomies that exist. So as a librarian, I find the use of standard terms and definitions helps immensely when trying to search for information. Data harmonization leads to the use of standardized terms and definitions. This leads to consistent terminology use, which all of that can lead to a more comprehensive search for information, less need to search for multiple terms for the same concept. And just quickly to mention another thing, if you are writing an abstract about the research that you've done, and you've used a survey or a data set, be sure to mention that in the abstract. And always be sure to use consistent terms in the abstract so that all of your good work can be easily findable by others who are trying to do the same type of work. So again, I recommend reading the American Journal of Public Health article. It has some additional steps to take going forward. When possible, reuse existing data sets. When not possible, use standard terms and definitions. There are many taxonomies, data dictionaries that are available. Consult the literature. And we showed you how to get to a PubMed search to see how some of the data sets and surveys may have been used in research. And your librarian. Librarians are generally very helpful people. They look forward to helping people find information and figuring out how to best use it. And one other thing that was mentioned in the AJPH article was about dissemination. And this is something that I think anyone who does research doesn't always plan for very well with the dissemination piece. So one thing that they mentioned was to share the results with the survey participants. Most of them don't have time to read journals, and if they're in state or local public health, they might not even have access to journals. So something to think about is to kind of bring them back in the loop and share their survey results so that they have something they can see the fruits of their efforts. So with that, I've gone slightly over time, but I thank you all for your time and attention. I am happy to be reached by email and will be available for questions later. And thank you very much. I am happy to turn it over to Elizabeth now.
Great. So this is Christine. Before we move to Elizabeth, first of all, thank you, Lisa. It's such a wealth of information and data that is out there and available, and showing us the tips and tricks to try to find the resources that we want. I especially love the connection between the searching for the data source and how it's already been used with the PubMed connection. That was really intriguing to me. So for all of you out there, our attendees, please enter your questions into the questions box, and we will once again review those questions and ask them of our presenters at the end of our webinar today. We'll now move on to Elizabeth Harper from ASTHO. Elizabeth, take it away.
Thank you. I appreciate that. And thank you for having me on the call today. My name is Elizabeth Harper. I'm the Senior Director of Research and Evaluation at ASTHO, and I'm very pleased to be able to take a little bit deeper dive into one of the data sources that was mentioned, and that's the Public Health Interest and Needs Survey, PHWINS. So what were the three aims of PHWINS? The first was to inform future investments in workforce development. The second one was to establish a baseline of key workforce development metrics. And three, to explore workforce attitudes, morale, and climate. So it's a really different survey effort for ASTHO. Historically, we've undergone survey efforts such as the ASTHO Profile or Forces of Change survey, where you have one survey per organization. With PHWINS, we were really wanting to understand individual worker perspectives. So we reached out to states to survey all of their staff, and I'll tell you a little bit about how we pulled this off. So just a little bit about the design. This data set is a representative sample of individual state health agency workers. We asked every state health agency to participate, and 37 in the first round said yes. So as you probably know, PHWINS was conducted for the first time in 2014. We also conducted a pilot in local health departments. We wanted to test out in 2014 the feasibility of what a nationally representative survey effort would look like on the local side. So we partnered with NACCHO in order to accomplish those goals, and we learned a lot of lessons, and I'll share what the future of the project is at the conclusion of the webinar. We also invited members from the Big City Health Coalition to participate. At that time, I think there were about 21 members, and so 14 big cities participated. So think about, Houston, Los Angeles, those larger metropolitan areas. Overall, between the local responses, big city responses, and from state health agencies, we had 23,000 individuals respond to the survey. So I want to touch briefly on data standardization, which was sort of the whole, or one of the purposes of this webinar, is to discuss, how we as public health organizations work together to standardize our survey efforts. During the creation of PHWINS, we didn't necessarily want to recreate the wheel. We wanted to look at what instruments and items were already out there that we could use and adopt to meet our needs and the goals of the survey. So to the extent possible, we utilized existing surveys and tools. One of those is the Council on Linkage's core competencies and their training needs assessment. There were several items that we adopted from that tool. We also looked at the Federal Employee Viewpoint Survey, where we looked at training needs, job satisfaction, different items that were on that federal survey. We found an already validated instrument to measure job satisfaction, and that came from the Bowling Green State University. They have a job in general scale that has been validated to measure job satisfaction, so we were able to use that already existing method as well. And then finally, and this has also already been mentioned, we used the University of Michigan Public Health Workforce Taxonomy to collect some of the demographic information about the roles that those public health workers were in. So for those of you that don't know, the taxonomy classifies workers into job role, function, different titles. So we were able to use that method to identify the workers' different positions. So we also pre-tested the instrument to make sure that what we were doing was valid. We conducted cognitive interviews of several individuals to make sure that with the instrument that we were creating, that individuals were understanding the question that we were trying to ask. This was an iterative process. We went through several different pre-testing efforts and ended up with a strong instrument. So PHWINS topics, what did we include within PHWINS? We wanted to understand what the training needs were at a national level of the public health workforce. So some examples of those items were systems thinking, communicating persuasively, and change management. We also wanted to understand what public health workers thought of national public health trends, or sort of the buzzwords that we tend to use as public health researchers and practitioners. So we wanted to understand what their level of understanding was of quality improvement, health information technology, the Affordable Care Act, and we asked a few other items such as health in all policies, for example. We also wanted to understand how workers felt about the workplace environment, and this had really not been asked at a national level. So we wanted to understand within agencies, what is the culture of learning? What are the job satisfaction levels of the public health workforce, and different worker empowerment items. Finally, there was a demographic section included in PHWINs. We wanted to understand the age, race, gender, education level of the workers that do these public health functions. This slide represents state health agency participation. As I said, we invited all 50 states and the District of Columbia to participate. This may be a little bit difficult to read, but you can see that the states that are shaded in blue are the states that participated, and any state that is in this green color declined to participate. This map is split up into paired HHS regions, and the reason that we did that is because the data is nationally representative at a paired region level. So the response rate for PHWINs was approximately 43%. So when we look at the data, we can make estimates based on these paired regions. So even for states that didn't participate, we are able to share some information about the workforce trends in their area. So I just want to briefly review some key findings of PHWIN so everyone on the phone can sort of understand what we can do with the data and what we've learned from the data. So one key finding was that 79% of state health agency workers are satisfied with their job. We were pretty surprised with this finding, understanding the ever-changing climate of public health. We found that 38% are planning to leave governmental health before 2020. When you break that down, it's that 25% plan to retire and 13% are seeking work outside of public health. Again, this finding wasn't surprising. We knew from the ASTHO profile and forces of change that we were in for a sort of mass exodus of the public health workforce because of the age distribution, so we weren't surprised to learn how many are planning to retire in the coming years. We found that 17% of state health agency workers have a public health degree. Most of those have their master's in public health. I think about 2% had a doctorate in public health or a related degree. We found that the mean salary range of employees is between $55,000 and $65,000. From this survey, we were also able to understand what the top training needs of the state public health workforce are, the top 3 of which include influencing policy development, the social determinants of health, and financial management. Another surprising finding was that only 52% of the state health agency workforce had heard of health in all policies. Understanding that that's a top priority for public health moving forward, we were surprised that only half of the workforce had heard of that national trend. So how to access this rich data source? So we do allow researchers and students to use and conduct their own independent research on PHWINs. Data are available at this link. The steps to accessing the data are just to visit that website, complete a short survey. We have just a couple questions about how you would like to use the data for our own tracking purposes. We have a short review process, and then we will execute a data use agreement and share the data electronically. I also wanted to briefly describe, who are using this data set, who are the users. And so far we have about 40 individuals or organizations that have requested to use the PHWINs data set. I first want to touch and highlight one of the products from the first round of PHWINs, and that's our special supplement that we published in JPHMP. So on top of those 40 groups or individuals that have requested data, we also have several articles written as a part of that special supplement, the link to which is on your screen. These articles in that special supplement looked at training needs, job satisfaction, morale, salaries, among other topics. Many of the data users are students. I am actually on someone's dissertation committee right now who is using the PHWINS data. We encourage students to access this data and use it for these purposes. Lisa touched on this, but we, as you know, ASTHO and NACCHO staff are always encouraging students to use secondary data sources when conducting these projects, just because of the overwhelming number of requests that our membership receives from those that are conducting survey efforts. So we like to encourage students to use the information that we already have collected, whether that be PHWINS, the ASTHO profile, Forces of Change survey. We have a large amount of information at our fingertips. Public health practitioners also use this data. When we conducted PHWINS, every state and locality that participated in the project received their own individual report. So they may not be using the raw data set that we will share with you, but they are using the data to take action. They are using the reports that we've provided to work on their workforce development plan, address their training needs, and incorporate the findings into their strategic maps. Stakeholders are also interested in using this data. We created PowerPoint presentations and reports for all the ASTHO affiliates, so organizations like CSTE and ASTDD. We've presented data that are specific to epidemiologists or oral health professionals, for example. CDC is also very interested in PHWINS and is supporting the future of the project. They have incorporated some of our findings in their new workforce development initiatives that they're working and moving forward with. We also work very closely with NNPHI and HRSA, all of which have asked or have requested more information about PHWINS. So that's just a brief summary of sort of how you use the data and who is using it. So I just want to take a couple seconds to discuss the future of the PHWINS project. We have received continued support from the de Beaumont Foundation for the next 2 iterations of this survey. So we are planning on fielding the second round of PHWINS in September of 2017, and we expect that the first round will be fielded in the fall of 2020. So we're very excited to have more points in time for this rich data source for individuals to use and be able to conduct some trend analysis and look at different points in time. So with that, I think I will turn it back over to our moderator.
Great, thank you, Elizabeth. That was so great to follow up Lisa's presentation with a wealth of data sources and to dive into one data source and see the process that you all went through in this very important survey. I love how you had tried to use different resources in the beginning for the standardization before you developed your questions, and how much further you've taken this analysis of this important group of people in the public health workforce, and now you've made it accessible to researchers and students. So it was just a good reminder after seeing all those different data sources that Lisa presented and knowing that behind each one is a process such as the one that Elizabeth presented. So thank you both for being here today, and I think we are going to take some questions from the audience. So attendees, feel free to type your questions into the question box in the GoToWebinar, as you can see here on the screen. I would like to ask Lisa a question, just in general, because watching Elizabeth's presentation and how to access the data, I know, I'm sure you don't know the answer to all the thousands of data sources you have, but are you finding there are different ways that people access data? I know, for example, like for National Center for Education Statistics, you can download the data right there. Other ways of accessing data are with data use agreements or different things like that. But can you just comment on what you've seen and maybe how that's changed over the last decade about accessing the data resources?
Sure, I can speak from my limited worldview here.
Sure.
it has changed a lot over the past decade, especially. I think the data.gov and healthdata.gov, which are completely free and open, are wonderful and available. Some of the public health organizations, ASTHO, NACHO, and the Public Health Foundation has their train data, where there's use of a data use agreement is required. Some other surveys also make their research or their information available with the data use agreement. Some surveys do require payment, some are copyrighted, so some are a little more tricky to get to, but there is a way to get to them. And some are just closed. Not everybody is happy to share. Most people are, but there are some, and a lot of federal data sources as well. There are a lot that are publicly available that you can just kind of go and download. There are others where you need to have some sort of data use agreement in place, and there are others that are you really just can't get to. So it really runs the gamut, but it does seem like people are more willing and able, especially now with the technology that's come along, to put the data up and allow people to download it and use it.
Great, thank you. Elizabeth, are there any other data resources at ASTHO that you would like to, maybe not that people can access the data, but maybe just reports or anything else outside of Public Health WINS?
Yeah, thank you. We do have, as I said, the ASTHO profile. So we have a few iterations of that we've conducted in the past, and we should be releasing data from the new ASTHO Profile 2016, this summer. So you can access those data sets with a data use agreement, and that's available online. We also allow access to our Forces of Change survey, which we conduct during the off years of the ASTHO Profile, which is more like a just-in-time survey effort that also includes some workforce, finance questions, and more timely topics such as State Health Agency Zika response, for example. So those are the most prominent data sources that we have to share.
Great, thank you. And Elizabeth, from your seat, what are you seeing as far as data and data access, just in general?
In terms of availability, or how we allow access to our data?
Yeah, have you seen just general changes? It just seems like, is this the first time that you've, with the Public Health WINS, that you've gone down this path versus doing reports and just providing that access to the data? And have you seen changes in that over the years?
Absolutely, and thanks for that clarification. Several years ago, it did seem like organizations and researchers were sort of holding on to the work that we were doing, and now I feel like we're getting to a place where it's the exact opposite. I know at least with the Beaumont Foundation, they are committed to sharing this research and this data set with other researchers, knowing that we can't do all of the research on this data ourselves. So it's critical to share the information that we have with others so that we can learn as much as we can from the data sources. And I think that is sort of a new culture that we're in, where our funders are encouraging us and requiring us to an extent to do that. So I think it's a wonderful change, and it's going to make it much easier for students to gain access. And hopefully, now that more data is available and openly available, we can start to standardize the survey process, minimize the number of surveys that we're conducting, with the understanding that the data that is collected will be shared.
Yeah, excellent point. Thank you. Well, I think we have some questions coming in, and my colleague Sarah will read those, and Lisa and Elizabeth, she'll let you know who it's directed towards. So, Sarah?
Great, thank you. I think that this first one is directed toward Elizabeth. This participant asked, or stated, Pennsylvania has 4 health-related departments, including the Health, Human Services, Aging, and Drug and Alcohol program. Do the data include all 4 departments?
That's a great question, and the answer is that it depends. When we were recruiting state health agencies to participate in WINS, we wanted to focus on what we would consider the core public health services. So if you're in a larger agency or an umbrella agency, we may have excluded, for example, mental health services. So for some states where they're under an umbrella, we ask them to limit it to their public health core staff and core activities. So it just depends on how the Pennsylvania State Department interpreted that, but we could look specifically in the data to understand sort of which bureaus and departments respondents were answering from.
Great, thank you very much. The next question asks, are Indian Health Service employees included in the public health workforce research? And I believe that could be really directed toward either of you, Lisa or Elizabeth.
So this is Elizabeth, and I'll start off by answering. And they are not represented within the PHWINS data set. We're looking to expand this year to the U.S. territories and freely associated states, but I don't think for this round that we will be including that population. We haven't to date, but it would be interesting to maybe reach out to NACCHO and see if any of the NACCHO surveys or work have included that population. So Lisa, I might ask you to also comment.
Yeah, off the top of my head, I can't say with certainty that there is or isn't. It's something I'd have to look into a little more. So sorry, I can't give a concrete answer right at the moment.
Okay. The next question is for you, Lisa. It says, Lisa mentioned that public health workers with questions should contact their librarian. In general, public health departments don't have librarians. Public librarians may not have specialized knowledge to answer questions, and academic librarians may be constrained to only help their own institution's members. Any other ideas where public health professionals can get information?
Yes, is the short answer. And I'm going to refer back to the National Library of Medicine homepage. And if you remember, the Public Health and Health Services Research was in the center column. Over on the right column, there is a link to the National Networks of Libraries of Medicine. A lot of those networks, it's broken up, I believe, into 8 regions across the United States. So depending on where you are, you could find your regional medical library. A lot of those medical library RML programs do outreach to the public health workforce. They have training directed that public health workers can take advantage of. They also have, even possible ways through a dockline system to get articles for you if you don't have access for articles. So yes, they are out there and willing to help. And if you don't have I realize a lot of public health departments don't have librarians, unfortunately, on staff, and the academic, sometimes public health departments are aligned with an academic facility, sometimes not, but there is the National Network of Libraries of Medicine, and they are there to help.
Wonderful. Thank you, Lisa. The next question asks, is there a particular database to obtain information regarding other countries' public health information? And this person has a particular focus on Latin America.
And I don't know. I would. This is Lisa. I would suggest checking the World Health Organization and blanking on the other source, PAHO. Would be places to check for that data. I don't know specifically what they may or may not offer, but World Health Organization and PAHO would be the 2 places that I would start to look for data on Latin American countries.
Very helpful. Thank you, Lisa. I think the next question is directed toward Elizabeth. Are public health workers in correctional settings included in the survey?
No, typically correctional health is outside the jurisdiction of state health agencies, so we don't have data on that specific population, but it's an interesting question.
Great. And as a follow-up to that, how about environmental control staff? In South Carolina, they are part of the state health department. Are they represented?
They should be, and someone can follow up with me specifically, but we do. Several state health agencies do include environmental services within sort of that core public health scope. So yes, I would think that environmental workers are in the South Carolina data. I also just want to mention really briefly, since we've had some state-specific questions, that data are released at a regional level. Unfortunately, we do not release state identifiers just because this is a little bit more sensitive data set. We're talking about job satisfaction and how individuals feel about their supervisors, and because we ask really specific questions about their job role and function, we can only release the data that way.
Thank you for that clarification. This question is for Lisa. In the first half, we talked about being able to look for data and how it is possible to pull up publications that were not published. Do we have to worry about false or faulty data if the publications weren't published, or how does that work?
Okay, that needs just a little bit of clarification. In HSRProj, it's mainly just a description of the grant or the research or the contract that was in place. So it's something that was done and that for whatever reason, and actually there are two places where research can go. One is the published literature, and the other is what we in the librarian world called gray literature. So that is, publications that are not controlled by commercial publishers. So that could be a CDC report, it could be a Robert Wood Johnson report or the Beaumont Foundation report, where it's on, the funder's site, but it may not make it into a journal publication. So gray literature is a lot harder to find and trickier to find. And then there are research and grants that just don't result in any type of write-up. And it's more just HSRProj allows you to see that this was done. The fact that something was done and not published, the great thing about HSRProj records is they do have the PI that you can contact. If you are interested in finding out, well, I don't see any publications, why wasn't, was there a reason why this wasn't published, or things changed slightly, there could be lots of reasons why something didn't make it to publication that has nothing to do with the quality of the data itself, but you may not be able to find data for that unless you go directly to the PI and you're able to have a conversation with the PI and talk about, what did or didn't work, why something was or wasn't published, or why you can't find a publication on that. It may be something that was in the gray literature and is, a couple of years old and has been replaced by 2 or 3 more recent reports, so it may no longer be available.
Wonderful, thank you. And this last one question is actually more of a clarification. At least one of your colleagues in a regional NLM office has said that while they aren't able to provide access to articles, they to the people who are contacting them, they're happy to consult with people about how they may be able to get access to their area. So just want to.
Okay. Thank you very much for that clarification.
You're welcome.
Yes, they just started a new 5-year cycle, so some things may have changed, and I apologize for that miscommunication, and thank you for the clarification.
All right. And I believe that we could take a few more questions if anyone has any. Otherwise, I'll turn it over to you, Christine, for any closing.
Sure. Thank you, Sarah. And thank you so much to Lisa and Elizabeth for being with us today. We appreciate you taking your time to inform our members about all these great data resources that are out there and available. And I do want to say one thing I always marvel at when I'm on these kind of calls, when I see all this data and you're just like chomping at the bit to get to it, is don't forget to also take the surveys that are asked of you. I know a lot of us are out there just wanting this data, and so let's be generous too in giving our time and taking the surveys as well. So any last remarks, Lisa or Elizabeth?
This is Lisa. I'll go real quickly. I just like to say thank you. I appreciate everyone's time, and if my contact information is there. If 2 days from now a question pops into your head, do feel free to contact me. I'll help in whatever way I can, and look forward to public health data access continuing to grow.
Yeah, thank you, Christine and Lisa. It was really nice to share this information today on this webinar. I'm happy to report that I've already received a PHWINS data request. So for everyone on the call, keep those requests coming. I'm so excited awesome. to receive those. So thanks so much.
That's great to hear. All right, Sarah, you want to wrap us up here?
Of course, would like to echo Christine's thanks to Lisa and Elizabeth for presenting to us today. And I want to remind everyone on the line that the webinar event page on the ASPPH website will be updated soon to include an archived recording of this presentation, as well as the PowerPoint slides, which will be available. And if you have any questions, please follow up with webinars@aspph.org. This is a sampling of some webinars upcoming, some dates to be decided, but watch the Friday letter for those dates and times and announcements of upcoming webinars. And as a last plug, we do have our ASPPH annual meeting and Undergraduate Public Health and Global Health Education Summit coming up in mid-March, and registration is now open. If you go to aspph.org, it is on the main site. Thank you all very much, and have a wonderful rest of your day.